Let's see. Left a message. I tried. I tried. I did. Canceled. Bruv, I did. What the heck? Never mind. Hey. Don't mind my hair. It's in the middle of getting done, but I'm at work right now, so. Not me and call prep. Okay. Fuck am I supposed to put? Missed appointment. Like, let me see now. Bruh, it won't close. What the hell? Like, like, I don't know. This system, I don't know if they be having issues, but sometimes the little, I don't know. Where is everyone? I'll wait. What do you mean? Hi, guys. How are y'all doing? What you up to? I'm working. I'm about to have to call somebody in a minute. Call another customer. Wait. I don't know what happened. But my manager had called me. I was muting y'all. I didn't mean to swipe off. Anyways, he told me to try to call her back. Hello, this is Dejanay Wright calling from Alight Retiree Health Solutions. May I please speak with Mary Brown? services. Are you comfortable with that? We do not offer every plan available in your area. Currently, we represent 68 organizations which offer 3,932 products in your area. Please contact Medicare.gov or your local state health insurance program to get information on all of your options. The number of organizations and products available will vary by your zip code, area, and any information we provide is limited to those plans we do offer in your area. Alight Retiree Health Solutions represents Medicare Advantage, HMO, PPO, PFFS organizations, and standalone prescription drug plans. Each of the organizations represented by Alight Retiree Health Solutions has a Medicare contract. Enrollment in any plan depends on contract renewal. Also, you are not required to provide health-related information unless it will be used to determine enrollment eligibility. At Alight, we strive to protect and maintain the security and integrity of your personal data. To see our full privacy statement, please visit retiree.alight.com/privacy. You are not obligated to enroll, and you will not automatically be enrolled in any plan. Your current or future Medicare enrollment status will not be impacted by meeting with an agent. All right. In one moment. Will anyone else be joining us on the call today? And are you able to make your own healthcare decisions? And could I please have you state your full name and the last four of social? Thank you. And the number that I called today, is that your mobile phone number? Would you like to receive personalized communications such as appointment reminders, educational updates, and other account information via text message? Oh, shit. Thank you. And can I please have you confirm your full street address? Thank you. And is your mailing address the same as your permanent residence address? Thank you. And what is your date of birth? Do you receive financial assistance from your state for like healthcare costs? Okay. It would be like Medicaid. Okay. Thank you. So today we'll be focusing on Medicare Advantage, Medicare prescription drug plans, and supplemental plans. And then if you're interested in dental, vision, or hearing, we can also look at those type of plans as well. I don't see any coverage on file. Do you have a plan right now? Medicare? Yes. Okay. Okay. And do you have your Part A and B effective dates? Is that for A and B? Okay. You said 2016? All right, so now I'm about to go on the Alight retiree page and we're gonna look at plans. Do you have any prescriptions? Yes, I'll be able to pull it up. One moment. All right, I see 6 prescriptions. Atorvastatin calcium, 20 milligram tablet, and you get 30 refilled every 90 days. Dorzolamide, 2%, and 3 refilled every 90 days. And it's a 10 milliliter bottle. Latanoprost, 1 refill every 90 days. And it's a 2.5 milliliter bottle. Lisinopril, a 20 milligram tablet. And then you get those refilled every 90 days. Methimazole, sorry. It's a 5 milligram tablet and you get 90 refilled every 90 days. And then last one, nifedipine, ER tablet, 60 milligrams. And then you get 30 refilled every 90 days. All right, and then your Dr. Carmen Eccles. All right. And what plan do you currently have? Let me see if I can pull that up. Oh, it's just original Medicare? Okay. Okay, so you're looking for a prescription drug plan today? Okay. So the first plan they have for you is scored a 100%, which I've actually never seen a plan score 100. Usually it's like 95 or something. So that's really good. It covers all of your prescriptions. It says your estimated total out-of-pocket costs will be $50 for the full year. And then it's a $0 premium. And let's see. Yes, ma'am. So with all your prescriptions, it looks like you'll be paying around $13 every every 90 days. Yeah. And if you want, I can email this to you so you can look at it as well. Or I don't know if you see it already online. The name of this plan is the WellCare Value Script PDP. The plan ID is S48021450. And I'm about to email this to you right now. Alright, so I did just send the email. You should receive it in a few. Alright, so more about this plan. The total out-of-pocket threshold is $2,000 or $2,100, but you won't even reach that. So that's good. Like, it's really low, your out-of-pocket costs. Yes, ma'am, just for the prescriptions. Now, are you looking for coverage for your doctor as well? Yes, that would fall under Medicare Advantage. So it's basically your original Medicare, and then uh, they also add on like the dental vision benefits and then prescription drug benefits as well. All right, so let's see. They have a new plan called Devoted Choice Give Back, and this is a PPO plan. They do cover your doctor, so that would be a $0 copay to see them. And then they do cover all your prescriptions, and let me see how that looks. The premium for this plan is $0 as well, and it's scored a 97. overall. So let me see. Okay, so for your out-of-pocket costs, it does seem to be a little bit higher. It'll be $31 every 90 days. And this plan would offer so inpatient hospital care for an in-network provider, $395 per day for days 1 through 5 for acute hospital stays, and then $0 per day for days 6 through 90. So you would have to pay for the first 5 days. And then for your primary doctor, like I already said, it is $0 to see them. If they were out of network, it would be $15 copay, but they're in network. So to see a specialist, it would be a $45 copay, and you would need prior authorization, which just means your doctor would need to refer them. Yes. And then for emergency room visits, your copayment for emergency care is $115. For your copayment for Medicare covered emergency care is waived if you are admitted into the hospital within 24 hours. They also have worldwide coverage, so if you're not in your service area, they will still give you emergency coverage with $115 for that copay. For emergency transportation on ground, it would be $315 for the copay. For urgent care, it's $0 copay. No, it ranges from $0 to $40. It says the minimum cost share applies to urgently needed services received by a PCP or your primary care provider. And the maximum cost share applies to urgently needed services received from the urgent care center. Okay, so if you go through urgent care for your emergency services, that's when you would pay $40. But if you're getting emergency urgent care from your primary doctor, it would be a $0 copay. And then for urgent care coverage worldwide, it's $115 copay. And then you do get a maximum plan benefit of $2,500. Oh no, I said that wrong. $25,000. Ambulance services, ground ambulance ranges from $0 to $315. The minimum price for that refers to facility to facility transfers, and the maximum cost refers to all other ambulance services. Let's see. So your out-of-pocket maximum for this plan is $9,250. Excuse me. And that just means that's the most you would pay. And then if you meet that threshold, you would no longer have to come out of pocket for that plan. Yes, that's for a year. And this is just like the cap. So they're not saying you're gonna spend this much. They're just saying if you do end up spending this much, then they'll cover the rest of it. And then let's see what else. They offer dental services, Medicare covered preventative dental. An office visit copay is $45, but you will need prior authorization for non-Medicare covered dental. They have a dental allowance. So this plan gives you $250 yearly, and this is towards preventative and comprehensive dental. You can see any licensed dentist in the United States. It does say you will pay the costs yourself at first and then submit a request for reimbursement to Devoted. Cosmetic procedures, dental implants, and or elective procedures are not covered. So yes, you get a $250 allowance every year, but the way it sounds is you have to submit a request to get reimbursed, but you'll have to pay out of pocket first. And then for their copays, I'm just gonna name them all because they're all $0. Oral exams, dental x-rays, prophylaxis, which is like a deep cleaning, fluoride treatment. Those are all $0 for the copay. And then they also have vision. For vision services, the copay can range from $0 to $45. It doesn't, oh yes, it does specify. Okay, so the $0 would apply if it's a diabetic retinopathy exam, and the maximum cost would apply if it's a Medicare covered eye exam. You do get one routine eye exam every year, and the copay for that would be $0. They have eyewear benefits. Your copay for contact lenses, $0. Same thing with eyeglasses, $0 copay. The lenses and frames are also a $0 copay. And you get a maximum benefit for eyeglasses of $200 every year. They offer hearing services. It does have to be in-network. Or wait, what plan is this? Hold on. Oh no, it doesn't have to be in-network. My bad. Okay, so yes, for in-network, the copayment for Medicare covered hearing exams is $45, and then for a routine hearing exam it is $0, and you get a maximum of one visit every year. For fitting and evaluation of your hearing aid, it's a $0 copay, but you will need prior authorization. And then the hearing aid, the copayment can range from $399 to $699, and you get a maximum of 2 hearing aids every year. And then they also offer preventative services and wellness educational programs. So like, let me see what they have. They offer counseling. These are just extra things. Cardiovascular disease screenings, cervical and vaginal cancer screenings, depression screenings, diabetes, nutritional therapy services, mammograms. And yes, that's what this plan offers, and this is a Medicare Advantage plan. Yes, ma'am. This has a $0 premium. So the only thing that you would be paying, oh, I'm sorry. Oh, I was gonna say the only thing you would be paying throughout the year like on a every couple month basis would be towards your drug deductibles. And then if you happen to see like a doctor that has a deductible, that's the only time you would be coming out of pocket for anything. But yes, your premium is $0. I'm sorry, could you repeat that? Oh yes, yes, ma'am. This has prescription drug coverage as well. And I can email this to you as well, so you can take a look at it. Because I know this is like, you know, you got to make sure you make the right choice. Oh my goodness. Yes, exactly. So so this plan is pretty new, devoted. Um and I don't know, it really depends because you might really like this plan or you might not, but the way that the system is set up to where they're gonna put the best plans based off of your needs. So, you know, based off your prescriptions, based off of how many times you see a doctor or what type of doctor you see. Um, and they're gonna compare all the plans and like how much you're gonna pay out of pocket. They take all of these things into account and then they basically give it to us and then we show it to you. So with this devoted choice, it tells me you're going to be saving $2,216 for the year. Because they also have the Part B premium reimbursement, and I can explain that to you. I just got to pull up the document. One moment. Okay, so it says if you are responsible for a Part B premium, we will reduce your monthly Part B premium by $184.70 per month. This reduction is set up by Medicare and administered through the Social Security Administration. Depending on how you pay your Medicare Part B premium, your reduction may be credited to your Social Security check or credited on your Medicare Part B premium statement. So yeah, I feel like that's a good perk too. Does this plan have over-the-counter benefits? Let's see. But that's why I like Medicare Advantage, because they do offer little benefits here and there to help you save money. No, they don't have it over the counter for this one though. Mm. I can try to look for them right here. You said they're an endocrinologist. Metani. Yeah, he's not popping up. Usually when the doctors don't pop up, that means that they're not accepting any plans that we have. But if you have a PPO plan, you would be able to see the doctor still, but you would have to pay whatever copay is associated with that. Usually when they're out of network, there is a copay. So let me go back to that. So yeah, for the specialist, it would be $45. But it's the same for in-network as well. In-network and out-of-network specialist is a $45 copay. Do you have any questions? your HRA. I see it. Yes. $1,825, and it becomes effective January 1st. Yes, ma'am. So you're pretty much right. You pay your insured directly for the premiums and out of pocket costs, and then you will be reimbursed. Let me see. Let me go to your specific HRA for your company. And I'm sorry, I'm just reading over this information. So yes, you would pay for your premiums and out of pocket expenses. You would submit a claim to be reimbursed, and then you will then be reimbursed. It would probably take, let me look it up. They let us know. I think it's 10 days. No, I believe it's 5 days, but I'm about to verify right now. Yes, so it would take up to 5 days for them to process the claim, the reimbursement claim. And more about the claim information. Your claim forms will be found online in your HRA account. And you know how to get there?